Hello, everyone. My name is Marianne Regan. Today, I'll be talking about cirrhosis. Cirrhosis is the process of progressive liver or also hepatic fibrosis secondary to repeated hepatic and liver injury, which results in the inhibition of liver nodule regeneration. Cirrhosis is a result of chronic and repeated liver injury, which causes progressive destruction of the hepatic tissue. Fibrosis of liver tissue results in the destruction of the lobular organization and the biliary ducts within the liver. Due to chronic states of injury and inflammation, liver cells such as hepatocytes, hepatic cellulate cells, sinusoidal endothelial cells, and Kupfner cells begin to transform into myofibroblasts and deposit collagen as a result. The accumulation of this collagen eventually leads to the formation of scar tissue and leads to the fibrosis of the liver. Due to this, the ability for the liver to regenerate is severely inhibited. The accumulation of fibrotic tissue also leads to diminished blood supply to the liver, and biliary ducts become congested. Complications of cirrhosis are an individual's inability to remove bilirubin, decrease production of bile. It impairs the digestion and absorption of the body. It also results in decreased ability to produce blood clotting factors. Cirrhosis also leads to the inactivation of many hormones such as aldosterone and estrogen, and decreases the body's ability to remove harmful toxins from the circulatory system. Cirrhosis can also cause serious disease states such as metabolic encephalopathy due to the accumulation of toxins within the body. And then liver failure can ensue from the cirrhosis and the severe damage to the liver tissue. And this often requires transplantation due to the fact that the liver has no longer the ability to regenerate like it does with more minor liver injury and inflammation. There are 4 major forms of cirrhosis, which are related to the primary cause of which the cirrhosis occurs from. Some of these forms of cirrhosis include alcoholic liver disease, biliary cirrhosis, post-necrotic cirrhosis, and metabolic cirrhosis. Alcoholic liver disease is the most common cause of cirrhosis. This form of cirrhosis begins with a disease known as fatty liver disease, where fat accumulates within liver cells and results in the in hepatomegaly, so the enlarging of the liver. Thankfully, at this stage, liver damage can be reversed. However, if repeated injury and inflammation continues, like many times it does with alcoholism and heavy alcohol abuse, this causes further damage to the liver and leads to the disease processes that we spoke of earlier, causing alcoholic hepatic and eventually end-stage cirrhosis, where there's just so much damage and scar tissue and fibrosis to the liver. Other common causes of cirrhosis are non-alcoholic associated fatty liver disease. Hemochromatosis is also another form, and then chronic viral hepatitis is another form of cirrhosis, cause of cirrhosis. All of these states can result in necrosis and fibrosis of the liver tissue and eventually lead to cirrhosis. Liver cirrhosis has multiple causes and can be the consequence of multiple disease states and risk factors. Some of these factors include obesity, non-alcoholic fatty liver disease, heavy alcohol consumption, infections such as Hep B and C, autoimmune diseases, mineral overload, and mineral overload such especially related to iron and copper. Patients with cirrhosis may initially complain of vague, nonspecific symptoms such as anorexia, weight loss, and fatigue. However, as the cirrhosis becomes more serious, the patient begins to decompensate, and signs and symptoms start to include jaundice, which is a yellowing of the skin, and is due to a buildup of bilirubin, pruritus, so itchiness, upper gastrointestinal bleeding, which might be associated with melena, and dark stools. Muscle cramping can also be associated with cirrhosis, abdominal distension from ascites, lower extremity edema, fever, easy bruising, and confusion, which is often associated with hepatic encephalopathy. Women with cirrhosis may present with irregular menses, anovulation, and amenorrhea, which can be caused due to the hormone imbalances that cirrhosis often causes. And then men can experience impotence, infertility, a decreased sex drive, and testicular atrophy. There are multiple diagnostic tests for cirrhosis. Diagnostic tests include multiple blood serum tests, such as serum liver function tests. This include AST and ALT coagulation studies to determine if there's prolonged clotting time, which can be associated with cirrhosis, and that can be observed through prothrombin levels. A complete blood count should be observed to determine if there's any form of anemia. Serologies may be obtained to determine if the patient has viral hepatitis or any autoimmune antibodies, which might be causing the cirrhosis. And then other studies include CAT scan, MRI, or transient elastography. But liver biopsies are the gold standards of diagnostic testing, along with the serum liver function tests. But the liver biopsy tests are a great tool to determine the stage of liver inflammation and fibrosis occurring in the individual. I hope you all learned something about cirrhosis today. I look forward to learning more on your topics, and here are some of my references. Thank you.